once somebody hits their deductible, the majority of the time, the benefits will then switch over to either copays or coinsurance. And a lot of them have a hybrid of both. So that's really how a health savings account and HSA deductible works. There are also non-HSA plans.
Welcome, listeners. I am so happy to have Todd with us today. With nearly 20 years of experience in the insurance and benefits industry, Todd is a member of the Self-Insurance Institute of America and Society of Professional Benefit Administrators. He leads our sales team, but he is the best salesman you'll ever meet. Todd doesn't sell. He walks people through their challenges and works with them to identify solutions. He really is the best non-sales salesperson you'll ever meet. He's more of a solutions guy than a sales guy, and we're glad he's made some time to spend with us today.
Welcome to our podcast, Todd.
Thank you for having me.
We've invited you to join us today because we have a listener question, and we know that you'd be the perfect guest to help us walk through some of these confusing concepts. So the submitted question was to ask us to explain deductible, copay, coinsurance, and out-of-pocket max. So those are all terms that we are familiar with. However, there's a lot of confusion in the industry, especially from members who are not familiar with these terms, and we were hoping that you could clarify. So do you want to start by diving in and, in your words, kind of explaining what the word deductible means in our industry?
Yeah, so first and foremost, I'd like to thank you for inviting me to my first podcast ever. And I also thank you for having the confidence to invite me to be a subject matter expert on this topic. But health plans have really changed. Benefits have really changed. I think Sarah noted I had nearly 20 years experience. For the record, it's probably closer to 15. She's trying to date me ahead of myself. But when I first got into the business, the majority of plans that were out there were all copays. And, there was a transition probably 10 to 15 years ago where employers started putting in, as well as health plans, fully insured plans, deductible programs where membership would have to have an out-of-pocket responsibility where prior to the benefits truly, kicking in. And so there's really two types of deductibles and two types of products. So the first one we'll talk about is probably the fastest growing one, and that's the health savings account. So a health savings account deductible, you literally have to pay every single claim out of pocket prior to your benefits kicking in. So in the instance that I am on a $3,000 deductible HSA plan, any medical claim, any pharmacy claim needs to be paid out of my pocket before the benefits kick in. Now, there are tax sheltered areas where people can obviously leverage pre-tax money, and that's through a health savings account. So for those of you that aren't familiar with all the industry acronyms, when I say HSA, it's a health savings account. And what qualifies a plan to be eligible for a health savings account is when both medical claims and pharmacy claims are accumulated together, and you have to hit a certain deductible threshold, which usually varies between a single and a family. For example, on my employee plan on the HSA program, singles have to hit $1,500 prior to their benefits kicking in, and families such as myself have to hit $3,000 prior to the plan kicking in. So with myself, I have pre-tax dollars that come out of my paycheck that go into my health savings account to help me cover these expenses prior to me hitting that $3,000 deductible. And so in an HSA program, once somebody hits their deductible, the majority of the time, the benefits will then switch over to either copays or coinsurance. And a lot of them have a hybrid of both. So that's really how a health savings account and HSA deductible works. There are also non-HSA plans. These are really, just as popular as HSAs, maybe not growing quite as fast, but these programs still have deductibles embedded in them. But a lot of times the plans may have copays available to them prior to hitting their deductible. So for example, we'll go back to having a plan that has a $1,500 single and a $3,000 family deductible. Well, this plan doesn't necessarily make all of the medical claims and all of the pharmacy claims apply to the deductible prior to benefits truly kicking in. So in a traditional PPO non-HSA program, you could have a $3,000 family deductible, but if you need to go see a primary care physician or go see a specialist, you can have a copay. For example, a lot of our plans might have a $3,000 family deductible, but if you go to your primary care doctor because you have the cold or the flu, when you walk through that door, you will just pay a $30 copay. And so if you were to need to go to a specialist, you would pay a $60 copay. Oftentimes, the deductible in these programs are truly towards the, I guess, higher costs. So things like surgeries, inpatient stays, outpatient stays. And so these costs will be subject to the deductible. And then the benefits won't kick in until that benefit is met. And so, for example, if you have a $3,000 deductible and you have a $6,000 surgery scheduled, you would be responsible if you haven't had any claims so far this year for medical. With that $3,000 deductible, no other claims being paid yet, for that $6,000 surgery, you would have to come up with $3,000 prior to those benefits then kicking in. And oftentimes that would be followed by coinsurance. So if an employee were to have 30% coinsurance and they had a $3,000 deductible on a $6,000 claim, they obviously would fund the $3,000. Then they would have 30% member responsibility on the additional $3,000, which would be $900. So if you had a $3,000 family plan, that would be your deductible, and you had 30% coinsurance after that deductible was met, and you had a $6,000 claim, your overall member responsibility would be $3,900, which is the $3,000 up to the deductible, and then 30% of the additional $3,000, which equates to $900. So I know that can be confusing. Healthcare is always extremely confusing. We're doing everything in our power to fix it, but that's how some of these deductibles work.
Can I also make a point to in network versus out of network? Because I think that's important too. You know, some plans have two sets of deductibles. So
yeah, absolutely. That's a great point, Jolene. So the majority of the plans that are out there, they will have both in-network and out-of-network benefits. And so historically, what you see for a differentiator between in-network versus out-of-network is the deductibles typically double. So we keep going back to that example of the $15,000 single, $3,000 family plan. That would be the deductible. That would be for in-network benefits. Traditionally, for out-of-network benefits, those deductibles would double. So in the example that we continually to use, the out-of-network deductible would be $3,000 for an individual and $6,000 for a family. So that's why it's always important to make sure that you're seeking care at an in-network provider. So whether it's calling the number on your ID card, going to a member portal, going to an app, always make sure that you're seeking out care at an in-network benefit level, because that's where you're going to really get the most bang for your buck. And if you ever are being referred out to a specialist or an inpatient setting by a provider and you identify that this is not an in-network provider, I would go back to that referring physician and say, hey, this is out of network. Can you find me somewhere in network that's going to be more cost beneficial to myself and my family?
Okay. There's one that's a high deductible health plan that you can pair with an HSA.
Yep.
And then after you hit the deductible, you might go into plan benefits that either have a flat copay fee or a coinsurance structure where you're going to pay a percentage of the cost, and then the balance is paid by the health plan.
Correct. And then, so that would be the HSA. And then the other high deductible plan can have benefits available to the member at coinsurance and deductibles prior to the deductible being met. But those would not be HSA compliant. So in that instance, you would not be able to set up as an employee a health savings account to use pre-tax dollars towards funding that. Now, you could still set up a flexible spending account to help pay for those costs, which would be beneficial and are highly underutilized by employees across the country. And also, so many employers will set up a health reimbursement account or an HRA that they will contribute dollars into to help their employees cover the cost of healthcare.
I feel like that makes sense. I mean, I feel like I get it.
Yeah, I mean, honestly, the health reimbursement accounts, to me, they're almost like an employer's first step into self-funding, right? They're figuring out a way to control costs, and they know that the higher the deductible that they have for their employees, the less their premium's going to be, right? Because there's less exposure to the insurance company. So they'll give you lower rates the higher the deductible is. So what a lot of employers do is they'll go out and they'll purchase the highest deductible that they possibly can, and it'll be the lowest the premium from the insurance company. But then they'll layer in a health reimbursement account for their employees to help cover the cost of that high deductible. And so it's with hopes that, obviously everybody doesn't hit their deductible because, the 90-10 rule, 10% of your population is driving 90% of your costs. So yes, you might have to fund 100% of your employees' HRA contribution, I guess, what you're contributing to the employees in the HRA, but not everybody's going to need that, So the hopes are that overall between the reduced premium, but what you're putting into the HRA and the employees actually spend, is going to be a win and a more cost-effective solution to where the employer was with a lower deductible option.
So I guess in general, if you're so to speak, a healthier person, a low cost plan with those higher limits might be the best fit for you. But if you've got more significant, healthcare expenses, it might be worth it to pay the premiums. When you think about open enrollment, right, and you make those choices each year, and that's something we've talked about on previous episodes, but really kind of evaluating your health needs and what would make the most sense for you from a payment standpoint.
Yeah, that's why education is really key, especially at the time of open enrollment. So most employers have multiple plan options, right? And, we see a lot of employers putting in basically the highest HSA option possible. And so right now, the HSA limit is $6,750 for a single, and then double that for a family. So an HSA plan cannot have any higher than $6,750 as the deductible, and that's what you can contribute into an HSA on an annual basis. Now, if I'm an employee, right, and I'm going into open enrollment, and I see $1,000 deductible plan with copays, and then I see the HSA, and it's 2/3 of the price, and I'm a 28-year-old single guy, have no intentions of having a family or getting married or having kids anytime soon, and I'm relatively healthy, maybe I go to my physical once a year, like I'm going to elect that HSA plan, right? And I'm going to put as much money into that HSA account as I can possibly afford. And I'm going to let those dollars build. Now, where I am at today, me personally, right? So I have a wife, a child, a growing family. That 6750 plan probably wouldn't be the best fit, right? So I'm probably going to look for something with a lower deductible, maybe even some copays prior to me meeting that deductible, because at the end of the day, I'm probably going to need healthcare services quicker throughout the year. And I might not have that time to build up a reserve or a surplus in my HSA to cover up to $6,750 in claims.
Well, and maybe I did it wrong when my kids were your son's age, but I feel like we were at the doctors constantly. So you're as a more frequent utilizer of services, then you're thinking about what is my cost going to look like over a year, over that next year with things I have planned, or if you know in advance that you can pre-plan a surgery, you might always be in a high deductible plan because that's really what makes sense for you. But then in that open enrollment year, you switch to a different kind of plan because financially it makes more sense for the way that you intend to use the system. When you have the luxury of being, having the time to have forethought about what what'll occur in the next year. But
kids are
at the doctor all the time.
Yeah, no, I mean, you're absolutely right, Sarah. I mean,
Oh, good.
we've seen, and it's not even just making that decision at the beginning of the year, right? If somebody knows they need two knee replacements, right? They're probably going to take a benefit plan with richer benefits if they have that option. They're going to get their first knee done in February or March, and they're going to try as hard as they can to get that second knee done before the plan year's over, right? Because if they hit their deductible, even if it was a low deductible, say of $2,000, they know that they probably just have copay or coinsurance for that second one, right? So we see at the end of the year, and it happened a lot with COVID when people started doing elective surgeries again, is you start seeing a lot of these surgeries that are higher cost, getting slammed in so that they essentially are getting paid underneath their member responsibility where they hit their deductible in that plan year.
So then you're just on the coinsurance or copay portion of your plan.
Correct.
Yeah.
Because your deductible's already been met.
Yeah.
And that could happen, obviously, with any type of plan with a deductible, whether it's an HSA plan or not.
Mm-hmm.
Good stuff, as always.
And very helpful.
Thanks for listening, everybody. Thanks for having me as a guest. I look forward to coming back someday.
Well, thanks again, Todd.
All right.
This podcast is brought to you by Nova Healthcare Administrators. Why did they let us do this? Because at the end of every day, every Nova associate is driven to do what is right. We want what's best for our clients and their members, and we do a great job sharing what we learn with each other. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people who we convinced, thanks Todd, to share their tips with you.
So don't forget to leave us a review, give us a like or subscribe, but more importantly, share. We'll find the insiders and you share it with the outsiders. You can find our podcast on Apple Podcasts, Spotify, and pretty much wherever you're finding podcasts. We're also on Twitter at UNDR, the coverage.